So you've just been diagnosed with diabetes, you've seen a diabetes educator, you've seen your physician, and you've been given a boatload of information. So much information that your head is spinning. So you say, what is my first step? You've told me ABCs of diabetes, A1C, blood pressure, and cholesterol control. And then you said I got to lose weight. And then you said that I got to take my medications on time. So where do I begin? The way I think about this is, if you begin with sugars first, remember, sugar is the main source of energy for you. If your sugars are high and you don't have the energy to do the other tasks, nothing else is ever going to get done. So where I generally begin is, let's get that sugar under control first. Then we'll start attacking the other things one at a time. So let's get that sugar under control. How do I get the sugar under control? That's where your doctor comes in. For the first few weeks, first few months, your doctor and your diabetes educator are holding your hand, teaching you how to check your blood sugars. So get that sugar under control first. Once the sugar's under control, then you determine, what is my next step? You have to ask yourself the question, what is it that I want out of this? Now, if you say that my problem is my weight, which is what led me to getting diabetes, then that should be your second target. After you've got your sugar under control with medications, you say, okay, now I have the energy. I should have the energy to do the exercise that I need to do. Because if I lose the weight, my cholesterol might get better, my blood pressure might get better. So then that would be the issue to think about. So if you have type 2 diabetes, I would begin with sugar and then consider what brought you to that step anyway. If it was the weight, then start working on that. And then the other things will start clicking in. It'll take some time. There are resources on the internet, there are books, your physicians, your diabetes educators, lots of resources. Many of the medications that you take, they will often have websites that have a lot of resources available to you. Now, if you have type 1 diabetes, then it's the sugar initially, and it can be quite overwhelming because you've gone from nothing in terms of any illnesses sometimes to a condition where you are measuring everything, you're taking insulin, not only at meal times, but you're taking a long-acting insulin. So the focus for patients with type 1 diabetes essentially is sugar, 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 all the time in the first few months of diabetes. And that requires a lot of help often from diabetes educators. And that's where I would put the focus. So treat the sugar first, then move on to other things.